So learning from the worldwide experience, we recommended that they develop a compulsory universal health insurance. Why it has to be compulsory? Well, the United States taught us the lesson, actually. When it's voluntary, one, healthy and young people don't want to buy health insurance. They are optimists. Many of them are optimists. They never think they will grow old. So they don't want to pay a premium for it. So who wants health insurance? It's the unhealthy and elderly people. But private insurance, for-profit private insurance, what is their duty? Their duty is make money for the stockholders. How do you make money for stockholders in insurance? Keep the unhealthy people out because they are high-cost people. In the world, not just only in the United States, we know 10% of people usually use up 60% of the resources every year. So if I can keep some of that 10% of people out of my insurance plan, I'm going to make a lot of money. This is not only the US experience. This is an experience around the world. So every country that wants to have affordable health care and the universal coverage have to use compulsion. But America today are unwilling to do that. Including the affordable care, is the government we're trying to induce the people with the income less than 4 times the poverty level, using subsidy to induce them to enroll. But that's an American problem. And I will not dwell on that. The second thing we designed is every patient should have a choice. Not choice of the insurance end. It's insurance that your doctors and hospitals. We ask people in Taiwan, what do you value most in terms of choice? Their answer is not insurance. It's when I get sick, I can choose who is my doctor, who is my nurse practitioner, which hospital I go to. May I make a comment here? Americans confuse this word choice. And I will hazard a guess, if you really poll the people with the right questions, they will tell you, it's not matter which insurance I have. That's not what I value in terms of choice. But it is which providers can I go to? And who take care of me when I'm sick? But we confuse these two things in America. So that's too much comments on America. Let me go back to Taiwan. You can see I'm loyal to America. That's why I'm making these editorial comments. The third design is we have a single payer in Taiwan, and that's run by the government, but it doesn't necessarily have to be run by the government. But in the Taiwan's political institutional context, we thought it would be better to be run by the government. Why do we recommend a single payer? Single payer can reduce the administrative cost of operating many insurance plans, because every insurance plan, like in Maine, like you mentioned Harvard Pilgrim offers a dozen products. Each product has its own rules, its own specification, what services are covered, and also what rules when those services are covered. When you are a provider and your patients are covered, let's say, by 5 or 10 insurance companies. Each insurance company has a dozen different products. Each one has a different set of rules. You're facing with operating under something close to 50 to 100 different set of rules. Just think the administrative apparatus you as a provider has to build up. We understand that. And that costs money. The money you spend for premium does not go for health care, but for the administration. Doctors, particularly, also have to deal with this administrative complexity and what's called administrative hassle. So the doctors have to allocate a significant portion of his or her time to deal with this administrative rules and complexity rather than take care of the patients. We just did not think it made any sense for Taiwanese to do that. And other countries, including your neighbor Canada, very early taught us that's not the way to go. So learning from countries like Canada, we recommended Taiwan go for the single payer. Then let me move quickly to what is the impact. You can give me a lot of lessons or concepts, but what did happen in Taiwan? Well, Taiwan passed the law and implemented its single-payer national health insurance by 1995. Very quickly, they have most of uninsured people insured. Now Taiwan has just about every Taiwanese insured. They even send people to under the bridges to find the homeless to enroll them. And the Taiwanese who live overseas actually literally fly back to Taiwan for their health care because it's free, almost nearly free and high quality. The benefit package introduced in Taiwan is very comprehensive. It covers not only outpatient, inpatient, you also cover drugs. It goes beyond that. It covers even Chinese medicine. It covers home visits by nurses. And so it's a very comprehensive package. The only thing it does not cover is long-term care. And that's a very expensive proposition, but also very difficult propositions because long-term care ideally is closely integrated with social services. So it goes beyond medical care. It really, and like in Scandinavian countries, long-term care is even integrated with housing. And you then build in the social services and home visits by nurses and doctors into that whole network. So we thought that's too complicated to actually take the quantum leap and then bring it into a national health insurance. It's affordable. Well, let me tell you what Taiwanese have to pay today. Taiwanese basically is paying this premium, which is based on payroll base. And it started out, it's 4.25% of the payroll. Employer pays a portion of this 4.25, employee pays a portion of the 2.5, and the government, to show its good faith that this is a social benefit for everyone, the government also pays a small portion of this premium. Of course, the government pays the premium for the poor people, for the veterans, for the and also subsidize the premium for the farmers and so forth. And now Taiwan, to maintain this, in order to maintain the system, and Taiwan went through a period of an economic downturn, that Taiwan will have to actually now, the contribution rate will have to be raised to about 5.17%. If you take the U.S. healthcare costs today and translate that to a premium based on payroll tax, I can guarantee you that percentage is going to be 9%, 10%. So Taiwan's, in other words, the premium rate, Taiwan's per capita income today is $33,000, about 20% less than USA. But Taiwanese pay much less than for their health care with that comprehensive benefit package than United States. What did the single payer do for Taiwan? The evidence shows what it does is the single payer gives you a one-time lower of the total healthcare cost. How did that come about? That come about is that it's come from a feature which very few people understand or even present in the literature. A single payer established a single electronic record. In Taiwan, they introduced smart cars since 1995 when they implemented the national health system. That smart card and a single uniform procedure to administer the claims allow you to create a profile on every provider, every physician's practice, and every hospital. You can easily using that information to identify which provider actually is abusing the system, which provider actually practicing inappropriate health services by maybe over-treating patients or under-treating the patients. Taiwan discovered, using this profile, Taiwan in the initial years right away isolated approximately 8% of its hospitals and doctors are really abusing the system, including committing fraud. So under the single payer system, Taiwan says, 92% of doctors and hospitals are doing a good job. Leave them alone. Let's concentrate our attention on this 8%. Actually, it gave more freedom to the 92% than trying to control this 8%. That's where the big savings came from initially. So Taiwan initially only had 2 or 3 big insurance companies insurance plans operating there. So you did not incur a huge amount of administrative costs, unlike the United States. So Taiwan is able to produce a little bit of savings from administrative costs because it didn't have so many multiple insurance plans. So the Taiwan's experience shows you can produce more than 10% of savings just by identifying who abused the system among the providers, then go after them. And if you read the GAO or the Inspector General or even FBI's report about the United States, you will see the magnitude they say that's the abuse and the fraud in our healthcare system today.